Good afternoon, Fuelers. Come on in. Hey, Fuel. Thank you so much for being here for today's webinar, Restarting Wisconsin. For those who don't know me, I am Corey Jo Biddle, the Executive Director of FUEL Milwaukee, and I'm so excited that so many of you are here to sort of get the behind the scenes story of how Wisconsin is going to reopen our economy. I have some great panelists here, as you all know. We got Judge Derek Mosley. How are you, Judge Mosley?
I'm fantastic. Thank you for having me.
Yes, thank you so much for
being to other people.
I know this is the new socialize. This is the new coffee. We're having lunch now. We also have Tim Sheehy. Hi, Tim.
Hey, Corey Jo. Thanks for having me.
Sure. I'm going to stop the share now so I can see you in gallery view. For those folks who are not familiar with Zoom, which is probably nobody at this point, but if this is a new platform for you, in the upper right, there are controls for you to change the way that you see our conversation. My favorite is the gallery view, so I can see everybody at once, but you might want to switch to speaker view, so take time to get comfortable with your controls now. Eric Kennedy. Hey, Eric.
Hey, everyone.
So Eric is here to help moderate our Q&A. So as you are enjoying the conversation, you're able to participate in the chat room. So in the chat room, you can talk to each other, and Eric will be monitoring that. So if you direct a question towards, or you have a question about what we're saying in the conversation, go ahead and talk about that in the chat. If you have a specific question that you want us to address on this webinar, go into the Q&A section, okay? All right, so I won't bother with introducing you because they've all read your bio a million times. All of our members know and love both of you, but I would love to talk to both of you and get a little bit of insight on the way that you see your work. So I'll start with you, Tim. Many people, even the Fuelers, some don't know that Fuel is a department in MMAC and that you're my boss. So can you talk to me? Sometimes. You're always, wink, wink, you're always the boss. Can you tell me a little bit about what it's like to be the president of MMAC and what does a Chamber of Commerce do?
Sure. So the Chamber has been around for 159 years. And if you think about it, somebody's been sitting in my seat during the Civil War, during the Spanish flu epidemic, during 2 world wars and countless recessions. And so up till now, I thought my job was not to screw it up. But this is, frankly, the most challenging time in my 35, 40-year career running an organization where the bottom has just dropped out and dropped out so dramatically. And so it's really challenging from 4 perspectives: the health, the safety, the community, and the economy. And those are all interrelated objectives that we try to balance as an organization under our mission of trying to make this a globally competitive location that has high value jobs that support a vibrant quality of life for all. And so I know we're going to come through it. It's just a really challenging time.
Can you tell the Fuelers how many members MMAC represents and which counties we cover?
Sure. So we represent a couple thousand companies that employ over 300,000 people in the Metro Milwaukee area. So small, mid-sized retailers that are closed, hotels, restaurants, bars, all the way up to the Northwestern Mutuals and the Johnson Controls and Harley Davidsons of the world. So it really is a good breadth of the region's economy.
Judge Mosley, can you do the same? Tell us a little bit about what is it like to be a judge and what exactly do you do?
So I'm the Chief Judge of the City of Milwaukee Municipal Court, and we are responsible for the adjudication of all municipal ordinance violations. So we do everything from as minor as a parking ticket. I'm sure no one here has ever gotten a parking ticket. And
no judge.
We also do traffic cases. We do non-traffic cases, so your assault and batteries, your vandalisms, things like that. We do juveniles, operating while intoxicated, building code, health code, and zoning code violations. Although we are probably the and I'll go through the hierarchy a little later. We are arguably the most busiest court in the state as far as cases that come through. We do anywhere between 80,000 and 140,000 cases a year. There are 3 City of Milwaukee Municipal Court judges, myself, Judge Valerie Hill, and Judge Phil Chavez. Which is also unique is that we're the only court in the country that's 100% minority. All the judges are minority, 2 African Americans, 1 male, 1 female, and 1 Latino judge, Judge Chavez. So that's basically what we do. We hold court at 7th and State, 951 North James Lovell Street. That's the city courthouse. But we also hold court at different various locations. I hold court at the Guest House Homeless Shelter to deal with our homeless defendants. Judge Chavez handles court at Vet Stand Down. He handles all the veteran cases. A lot of our defendants are vets. And Judge Hill is responsible for the warrant withdrawal Wednesdays that we have throughout the year.
That's awesome. Thank you so much. Okay, so the reason why I brought you two together is because as we start to move along the path of reopening Wisconsin, there are a lot of questions, as you can imagine. I know you guys are getting questions all the time too, but especially from the FUEL membership and our subscribers who've sort of been following the webinars and the information we've been sharing about what the new normal might look like, and you know, what are the steps that we need to take, how fast, how slow, a lot of the details. And I think what's really interesting is what I get to see is a lot of the behind the scenes work. Even though I'm not always in the room, I can see when you all are working on weekends and the conversations that you're having and the plans and the revision of plans, and a lot of that I think, you know, most of us are getting our information from the news and sort of what we can see, but not necessarily seeing behind the scenes and the thinking and the process behind it. Both of you are privy to a lot of that information, a lot of that process, and I thought it would be great to bring you guys together to share that with the members. So I already see people asking questions and raising their hands, and so I think we have a lot of ground to cover, and I kind of marketed this and let the people know we were going to talk about the state Supreme Court case, MMAC's Smart Restart Plan, and a bevy of other topics. So we're going to bounce around all over the place, but I think we should probably start with the state Supreme Court case, because I'm guessing that any minute there'll be some new news for us as soon as we hop off of this webinar. So Judge Mosley, I'm going to start with you on this. Can you give us a little bit of background around the case? And I saw you kind of sharing this. We were watching it live on your Facebook watch party. Give us the history behind this and some of the implications around the case.
Sure. So in the interest of time, Governor Evers had issued a safer at home order for the state. And when he ordered that initial order, my understanding was that everybody pretty much agreed with that initial order. There wasn't a whole lot of bite back from that order. But then things got a little sideways after that order was extended. The governor used the DHS, Department of Health Services, and using their emergency powers to, in essence, extend that order, which now expires on May 26th. I'm looking down on my phone just to make sure I don't get a breaking news as we go through this, because everybody's anxiously waiting the result. But basically, the legislature sued DHS and asked that they sued at the Supreme Court. And it's an interesting hierarchy on this, because they went right to the Supreme Court, and the Supreme Court took the case, which isn't a normal course of action, but in light of the situation, they took the case. And basically the legislature is suing because, just to put it in a nutshell, they think that DHS has exceeded its statutory authority by, one, closing non-essential businesses, and also asking that ordering citizens basically to stay at home, and prohibiting any non-essential travel. They're arguing that exceeds the scope of the authority of DHS, and by extending that order, they're asking that the order actually be tossed out as invalid. So that's the basic synopsis.
I'm going to share a screen so we can show the hierarchy, and you can kind of explain this a little bit for us.
Sure. So you have the Wisconsin judicial system hierarchy laid out, and these are the courts that are in the state. Like I told you, I represent I like to think of it as sort of like a rung on a ladder. So we are the first rung, the court that I sit on, which is the municipal court, and I told you what we are responsible for. There are 252 of us across the state. We represent individual, all the offenses that happen within individual municipalities. Right above us are circuit court. There are, I believe, 72 counties in the state of Wisconsin. Each one of those counties is represented by a circuit court, which is responsible for civil and criminal matters there. The smallest county having one judge, and then the largest county in the state having 46 judges, which is Milwaukee County. Right above the circuit court is the Court of Appeals. They hear all the appeals from the two lower courts, my court as well as circuit court. And as we are talking about right now, the higher court, or as I call them, the Supremes, the Supreme Court, and my bosses, they are responsible for taking any cases that they determine they want to take. It's called certiorari, where the Supreme Court makes a decision on what cases they want to take. And we're here today because they decided to take this case here today.
I mean, it's kind of, I want to ask a question about what, if this is precedented or normal, or the use of DHS's power is something that the governor would normally use, but this is sort of, I don't know, we've never seen anything like this before. So are they just getting creative with how they are extending the orders? How do you see it?
Well, that's the whole crux of this case. The whole crux of the case is the legislature is arguing that they did in fact get a little creative by extending this order and basically taking things that are lawful activities and making them now unlawful with punishments that are criminal, basically. And so that is the basic underlying theory of this case. That's why the Supreme Court granted cert to hear it, because it is an important case. But it is surprising to me, though, that we haven't gotten a decision yet, based on the fact that they did grant certiorari to get the case. And now we're, roughly 15 days or so, I think, before the order actually expires on its own. So it's we're cutting it kind of close, especially because of what's happening with this case. Basically, the legislature is, through its attorney, Ryan Walsh, is arguing. I'm probably the only person who's watched this video 3 times already. It's sort of like there's no sports on. So this is I grab some popcorn and sit and listen to this all day, which I kind of enjoy. But anyway, Ryan Walsh, arguing on behalf of the legislature, is arguing basically that the statute or law that they are imposing, Governor Evers and as well as the state is imposing, isn't actually a law at all. It's a rule, and since it is a rule, that rules must go through the legislature to determine terms of those rules before they're actually enacted. So before you can say we're going to extend this out, they should have come to the legislature to have it reviewed, set terms before it was ultimately enacted. The Department of Justice is representing the state under Attorney Colin Roth, and they are arguing, in fact, that they are operating under the statute, under the state statute. The statute grants, I think, Wisconsin Supreme Court's Wisconsin Statute 252.03 parent 3 allows DHS to actually close schools, churches, limit public gatherings during the times of a pandemic or any other types of outbreaks which threaten the citizens of Wisconsin. So what is interesting about the case, and you can hear the justices in their question, what was the course of action? What exactly is the legislature asking? What is their remedy? What do they want to happen? And the concern is by the justices, if they say that this rule or law is invalid, that in essence, it's off the books and everybody just goes out and does what they've been doing their entire lives without any rules or any set anything set. And I know the justices were upset about that, concerned about that, and asked several questions about how to deal with it. So, yeah, so that's the basic gist of the Supreme Court portion.
Tim, what is the business community hoping happens when we hear about the decision?
Yeah, so there's a legal answer, which you got from Judge Mosley, and there's a practical answer. And the practical answer is that if the court rules that the current DHS order is invalid, then you could go back to the legislative process for approving administrative rules. And quite frankly, that could run the clock out past May 26th. So I think what businesses are really focused on is, moving from crisis to recovery to the new abnormal, as I've heard some business leaders talk about. And the important thing is to look forward and understand how businesses are going to operate in the new normal. And I think the governor had a very difficult job in terms of putting Safer at Home together. It's by its nature without picking on the governor, it's just a very blunt instrument to tell some businesses to close and others to stay open. And what we're trying to focus on now is, what is it going to take to build consumer confidence, and what's going to take to build employee confidence? Because those two things are going to be critical to both safe, healthy workplaces and getting this economy back operating. We did a little bit of research into the 30% drop in Wisconsin's gross domestic product, and only 5% of that is due to Safer at Home. In other words, businesses that can't open under Safer at Home. The bigger impact on the economy is, again, consumer and employee attitudes. And if you think about this going forward, and maybe the simple way to do this is just to put this in an example. If I'm Northwestern Mutual and I have 6,000 people on my campus, and by fall, there are only going to be 150 to 300 of those folks back on campus, a large number of people aren't going to be commuting to work. A large number of people aren't going to be going out for lunch or dinner after work downtown. If I'm working under those conditions, again, I want to feel safe before I'm going to go back to work. If I can do my work remotely, I'm going to continue to do it in that fashion. But then think about that company multiplied by thousands more that aren't going to be traveling, that aren't going to be, going to hotels, that aren't going to be spending money on the road in restaurants. And that's where you have this kind of growing economic impact. And so that's why I come back and say the biggest concern here is, again, building consumer confidence and building employee confidence.
For the MMAC members, and I'm thinking about myself, the day before the Safer at Home order was put in place, FUEL Milwaukee actually had an event where we went to see play at the Rep. And they came out and told us to social distance, that we could kind of spread out in the theater. And I remember thinking, is that really necessary? It just didn't hit me as real. The next day, you had a conference call with all of the MMAC staff members and kind of laid it out for us what was going to happen. And I just remember being terrified and calm also, because it seemed like you had a plan and that it was well thought out, sort of what we were going to do, even though we didn't know what was the next step ahead of us. I just have a sense that a lot of the businesses in MMAC, within MMAC, CEOs, the leaders, department leaders, and our members had to have that same confidence with uncertainty in front of them. How were you able to make these decisions so quick about how to handle the staff immediately?
Well, I think like a lot of companies, we learned from members of ours that have businesses all over the world. And so in some respects, we had a month or two head start with companies that had operations in China, Singapore, Korea, Europe, Germany, Italy, Spain, and you start to watch this roll through their businesses, and they saw the experiences their employees went through, their employees' families went through, people going to the hospital, not being able to get visits from family members, in some cases, unfortunately, dying under those conditions and not having their family around them. And so it really kind of set a path for us that we could learn from as it came here to the United States. And so we learned from our members, and then a lot of companies got ahead of the challenge and really wanted to put in place something that would make their employees safe, and go ahead and execute on that. So again, we'd like Safer at Home lifted earlier than the 26th of May. We think the healthcare indicators are in the right position. The hospitals are prepared to handle this wave, but I don't want anybody under the false impression that whether it's May 13th, a Supreme Court decision, or May 26th, you're not going to see a lot of employers bring their employees back quickly, and they're going to bring them back in waves as they learn how to treat any spike on their campus, and as they social distance on their own footprint, and quite frankly, as they've learned to work remotely now. And so we aren't going to see a return to normal as everybody knows it until at least the mid to late fall.
Let's transition into talking about MMAC's Smart Restart plan. Can you tell us a little bit about the process that you all went through to develop it, and what's the crux of the plan?
Sure, and I don't know if I have a slide there, Corey Joe,
Yeah.
that you can just pop up. It'll help people, and I'll do this quickly just to orient everybody to what we were trying to address here. And you think about this as you can go ahead and put there was another one you had with all the next click maybe that had health, safety, economy, and there you go.
Yeah.
And so while we represent the business community, we recognize that the economy doesn't function on its own. And the first thing people have to do is feel safe going to work. And in this case, they care directly about their health. So if you can't address safety and the health impacts of COVID-19, you can't really run a business. And as we're seeing, the economy suffers. So what we're trying to do is, again, balance these interrelated goals of health, safety, community, and economy. And there are really three key players: the business community, the healthcare institutions, and the epidemiologists, the science behind it, and then the governmental leaders, whether that's the court, the legislature, or the governor, and the public health officers, who are by and large out of the spotlight, but have been thrust into this, making decisions about where it's safe to come back, when it's safe to come back, how many people can be in a business. And so if you take those entities, where we're trying to operate there is right in the center. And our goal has been to inform our members, get the best information we can, inform them of what's going on, advocate for policies that balance those four objectives. And then the third one is to collaborate. And that's where we've seen a lot of employers come together and share best practices about standing their business up, dealing with their employees, making sure their workplace is safe, figuring out how to work remotely better than they are. And so that decision-making process comes together. And again, it's the most difficult thing I've ever had to balance in my career. There's a political science or social policy answer for this, and it's called a wicked problem. And what it does is take input from different value systems, different constraints, political, economic, and personal, and wrap those all together and try to come out with a decision that keeps people happy.
I'm going to show my screen again, Tim, because when I was looking at the Smart Restart plan, there's sort of I wonder if this is the right one, sort of a dashboard of indicators, health indicators. So many people know that MMAC has been doing daily webinars with the medical college, sort of tracking our progress and whether or not we're ready to go back based on these indicators. And I just thought that this was really interesting, that the plan is based on the science and tracking what is actually happening with COVID-19, the availability of testing, which we all know opened up 2 new centers yesterday, cases, care, access to PPE, tracking. There's a lot of science and thought. How long did it take you to kind of pull all this information together, and sort of who was in the room, and what did the conversation look like?
Yeah, and so this is the challenge, and I just listening to the judge, I appreciate how much I don't know about the legal system and the court system, and I know even less about epidemiology. I know enough now to be dangerous, but part of the challenge in making these decisions is balancing all this data and balancing these differing perspectives on the challenge in front of us. So if you are in public health, your goal is to protect public health, to look at these outcomes and to make sure you mitigate them. And that can be in conflict with what's, going to get an economy up and running, which can be in conflict with people's health and safety in their workplace. And so as we work through these, it's understanding the data, it's trying to be transparent with it, and it's trying to understand, as we've used those 5 measures as kind of a gating system to open the economy, how do they work? And when we looked at, for example, the number of cases to start, it used to be the days in which the case rate doubled, the number of days it took for the cases to double, or the daily growth rate. And then you start to look at testing, and testing was a decent measure until we started to test everybody. And then it's really the percent of positive tests. And so for the uninitiated, of which I would include myself, it felt like the goalposts were always moving, when what they were trying to do was find the best data to give us a snapshot of where we were today. And what we tried to do was put our business leaders in the same room with our healthcare leaders. So we agreed on the data we were going to use. And it's when the healthcare providers came back to us and said, we believe that the curve's been flattened enough that we can open our healthcare systems back up, that we felt it was time to move more quickly. And we spent, a Saturday and Sunday going through the data. We got a group on the phone with the governor. We encouraged him to implement something like SAPER at home and supported him doing it. And when we got towards the end, I'd say 2 weeks ago, we got another same group on the phone. We got the governor back on and said, we think the data shows that we should open this more quickly than your plan is indicating. So we're just trying to provide the best input and advice we can to those that have to make those policy decisions.
And it's common for MMAC to advocate in this way? Obviously not in this specific situation, but to bring to the conversation for legislators the exact viewpoint or perspective from business leaders.
Yeah, it's very common. It doesn't make us right. And what we try to do is, again, balance those interests and provide what we believe is the best path forward, and communicate to the governor and the legislature, and not try to be political about it. And so we did have concerns early on that opening the economy too quickly was going to be problematic. And now we're on the other end of this, thinking that the economy isn't opening quite quick enough, and that businesses are now prepared to make decisions to protect their employees and to earn the confidence of consumers back. And we'd like it to go a little faster than it is.
Judge Mosley, how closely are the interests of groups like MMAC and legislators and the ability of MMAC to impact laws and rules and be a part of the conversation and shaping the way that Wisconsin runs?
Well, I mean, I know you're familiar with the fact that we are 3 separate branches of government, and so the legislature is responsible for making those laws. We are now in the process of seeing the judicial branch actually interpret those laws and then ultimately enforce. But I think Tim hit the nail on the head when he talked about all those parties. When I heard him say all those parties were together in a room talking about how they were going to help reopen things, I think that's what's the most important, because even though the nuts and bolts of the court case are exciting to me, they're not exciting to everybody else. But the important thing to remember is that the Supreme Court is going to issue when this order continues or doesn't continue, or in the future, what's going to happen if we have a bounce, some type of reinfection or later on in the year that they're predicting. So it's really important, because if they just say, all right, it's an invalid order and everything goes back to normal and we have no vaccine, then we can expect for sure that there are going to be people who are going to be infected. And so I'm encouraged to hear the parties are getting together in a room, and I hope as we speak today that the legislature is actually already getting in the room thinking about what they're going to do, because in their lawsuit, they actually asked that no matter what the Supreme Court decides, that they stay that for 6 days so they can get together and come up with a rule. And so I'm hoping that they're in the room now so we won't have to use those 6 days and we can get a decision from the Supreme Court and just keep it moving.
Yeah, so part of the reason too why we wanted to do this is there's a big mix of the kinds of people that are on this webinar and in the FUEL membership. About half of our members that are registered aren't from Wisconsin originally. So not only are they learning their environment, they're also learning about the processes and the road to them being engaged in the civic world and community within Wisconsin and Milwaukee. So I'm wondering, I mean, even beyond the Supreme Court case, there's going to be, I'm guessing, more legislation, more decisions. I mean, uncharted territory around what we've all been through in this pandemic. How can folks sort of advocate and raise their voice, bring their voice to these decisions in the same way that MMAC as an organization has said, hey, these are our interests and this is how we see it. For everybody that's listening, what can they do, as we know decisions are going to continue to be made, to make sure that their perspectives and voices are included at the table? I'll start with you, Judge Mosley. Do you have any thoughts on that?
Well, I think you're seeing what's going on in across the state, from people abiding by the safe at home, staying at home, or going out and wearing masks as they go out in public, or practicing social distancing. And then you see also people who are upset and expressing their frustration by protesting at the Capitol, so that the legislators know that they are also concerned about what's going on and want to get back to what we have been calling the new normal. So I think those are the two main ways that you're seeing people exercise their rights and to be heard by the legislature on how they want things to proceed.
How about you, Tim? Any thoughts on that?
Yeah, I mean, democracy is messy, and it gets messier sometimes when we have big challenges like this. It's an elected form of government, so you've got to reach out to your elected officials and kind of offer your opinion, your suggestions. And in this case, it runs the whole gamut from, you know, your village president to your common council member to your county board member to your state representatives to the governor, because they all have a role in determining kind of what happens in the public health arena that we're all dealing with. I'm very fond of a statement that comes from a book that Edward Gibbon wrote about the rise and fall of the Roman Empire. And he said this, he said, when what the Athenians wanted most was the freedom from responsibility, then Athens ceased to be free. And I think the underpinning to what we're doing is that people participate and take individual responsibility for not only their own actions, but for their government. And when we do that, we're stronger. And when we abdicate that responsibility or turn our backs to it, it's much more challenging to make decisions.
We're going to go into the Q&A and have Eric sort of pull some questions in. But before we do that, I kind of want to ask you both and start with you, Tim. You know, Milwaukee County has 19 municipalities and that operate independently. Has there been any effort or anything you can share around what the different governing bodies have been doing to work together, and if why is that important that they work together? What would it look like if they didn't?
Yeah, I spent almost all day Saturday and most of Mother's Day on Sunday talking to the new county executive, to the mayor, to a bunch of the municipal leaders, to our healthcare officials at the local level, kind of going back to Judge Mosley's point, if the Supreme Court rules and there is a gap between now and when the legislature makes a decision on a rulemaking process, that this devolves into local governments and local healthcare officials making their own determination. So we tried to work as one party in this over the weekend to make sure that all 19 municipalities, 11 or 12 of which have health commissioners, we don't have a patchwork of rules and regulations that affect how businesses operate. And so trying to get the whole 19 municipalities to come together with one decision. I would say we're getting close. And again, I give our new county executive, David Crowley, and Mayor Barrett and Mayor Kennedy from Glendale a lot of credit for kind of orchestrating that, so we don't wake up with a surprise, or we don't wake up with 12 or 13 different healthcare regulations in Milwaukee County.
What would happen if there were different rules? Could that affect two neighboring businesses in completely different ways? Like, what would that look like?
Sure. I mean, I can think of it exists between Bayside and Fox Point. There's a strip mall called Audubon Court, and kind of given a lack of planning, you could literally have two businesses side by side, one open and one closed. And so that's important, and it's important because not only in Milwaukee County, but 50% of Waukesha County commutes to Milwaukee to work. So we really have to look at this on a regional basis. As somebody, and it may be not the politest thing to say, but if you're swimming in the deep end of a pool and little kids are tinkling in the shallow end, it's going to get in the water. So we got to work together.
Classic, Tim. Classic. I love it. Eric, tell me, what do you see in the chat, in the Q&A?
Yeah, so one of the questions was, what implications will the repeal stay-at-home order have for non-essential businesses, individuals who feel they have sustained the losses as the result of the order? Will they have standing to sue DHS or the state of Wisconsin to recoup those losses?
I'll let the judge take the legal question. I'll take the business end.
Okay, so what's interesting about the legal piece of this question is that if you listen to the argument, it appears that the state is arguing that they have the authority to do what they are doing. The legislature is arguing that the actual statute that they're looking at does not extend that authority to them. The justices themselves are arguing that maybe this statute is too broad. If the statute is overbroad, then it is deemed to be unconstitutional. And if it's unconstitutional, then you have this interesting piece going on, because what's missing in the statute is definitely a limit on the power, right? So the only real limit on the power of the DHS is judicial review. And that's where we are right now. It's at the Supreme Court. That's the only real limit that they have right now, is judicial review. So it's going to be difficult at that point to sue the state if the state was really actually.
No. Did he freeze? Okay, Tim, I'm going to have you.
Sure, I'll just pick up the business end of this.
Yeah.
Is it?
Oh, wait.
Okay.
The world of Zoom.
So,
yeah.
To Judge Mosley's point on the business end of this, as I mentioned before, safer at home by its very nature, and again, it's not a criticism of the governor, it's just difficult to enact, was a very blunt instrument. So you could take a small member of ours like Built Right Furniture in Greenfield, which sells furniture, some of it for senior citizens that's, necessary to get in and out of a chair or in and out of a bed, and they're closed under safer at home. And then you can go to Walmart or Costco and buy the same furniture. So that business feels aggrieved because it is closed when a competitor is open, and they can make an argument that we can social distance just as well as a Walmart can, but because Walmart sells other essential goods, they're open. And so this is the challenge inherent in the nature of trying to open and close businesses based on somebody's definition of essential, and it's very hard to do that from a public health perspective.
Another question, Eric?
Yeah, so someone that wrote is a business owner of an event floral business, who is dependent on gatherings beyond 50 people. What is the prevailing wisdom that both of you have around advising clients on planning events for the remainder of the year?
Well, it's very interesting. I never thought in my job I'd be in the wedding planning business, but I've gotten so many calls from board members and other members of ours who have kids that are getting married over the summer and the fall, and they want advice as to whether or not they're going to be able to hold a wedding reception or a wedding itself. And if you look at the Badger Bounce Back Plan, and again, hours from now that could be tossed out. The first phase, which would start as late as May 26th, would allow everybody to be open with the exception of bars and allow gatherings of 10 or less. The next phase goes to gatherings of 50 or less, and then the third phase kind of opens it up. So the question is, if that stands, how quickly will we go through that gating criteria? And so I would say that a lot of people that have, weddings over this summer have been postponing or moving them. And I know some as early as the fall. And then again, that depends on how far guests are coming from. Do they have to fly here? And how people feel about the safety of holding large gatherings. But I would say if you're looking at businesses doing large gatherings, I don't see that happening well into the fall.
Yeah, as someone who actually officiates a lot of weddings, I have been in contact with all of my brides and grooms for May, June, July, and August in regards to their weddings. And they want to get married on those dates. So we're making arrangements where they come and see me to do the wedding, and then we're setting out the actual ceremony for family and friends till later. Because at this point, we don't know what's going to happen. And when you're talking about a wedding, you're talking about 50, 100, 200, 300 people. And right now, under the criteria, it just can't happen.
Yeah.
Are you saying anything else, Eric?
Yeah, so I asked Judge Mosley this privately, but as many of you know, if you haven't seen the news or seen some of the read the newspapers, his journey of recovering from COVID-19 is truly inspiring, along with the support that he received. So Judge Mosley, as someone that has recovered from COVID-19, any feedback on how to limit exposure and empower employees who have fears about returning to work, particularly in vulnerable populations?
Yeah, so I'm actually going through this right now. I'm actually in constant contact with my infectious disease doctor because I'm in a weird situation. I'm not really quite sure how I contracted the virus. As we trace back, counting backwards, my exposure, it could have been in court, it could have been at seminar. I don't really know the exact date and time. So my infectious disease doctor is telling me that I need to practice social distancing. I need to wear a mask. I had to make sure that I'm not putting myself in a situation that puts me back at risk. I am the extreme. I haven't left the house since I got released from the hospital. And the reason why is I cannot go through that process again. There's nothing worse than not being able to breathe. And we've had such a low success rate on people on ventilators that it's just too frightening to risk it. So my advice from my doctors are, if I do go out, I have to practice social distancing. I have to wear a mask, protection not only for myself, but also for others around. And they're telling me that I have to abide by the rules of no more than 10 people in the location where I'm at, which has made it interesting for court because we definitely have more than 10 people that come into court. So I'm holding my court sessions remotely until I know what happens on May 26th.
Awesome. Thank you for sharing.
Mm-hmm.
Another question that, Tim, maybe you probably would know this a little bit more, is that what have you heard from local businesses and leaders are the protections that that individuals and businesses are doing to ensure social distancing when the safer at home order is lifted? Have you heard any innovative ideas, or have you heard of any concepts of how they plan on practicing social distancing?
Sure. I can get Corey Joe a link from a webinar we did this morning with the Chief Human Resource Officer from Manpower, Direct Supply, and Northwestern Mutual, and you can get some great insights into how those companies are doing it. But first of all, they're going out surveying their employees, trying to understand who can work remotely, and whether it's absolutely critical and necessary that they be in the office. If it's not, most of these companies are going to be slow movers. I don't see them bringing their employees back to work until the fall. And in that case, they'll do it in a staggered way so they can stay ahead of any spike. If there's a situation like Judge Mosley's, they want to be able to identify it, to track and trace, to make sure it doesn't spread to their other employees. They're going out and purchasing PPE equipment. Some are requiring masks in the workplace. Companies with cafeterias are not going to operate their cafeterias or their gyms. I've heard some larger companies, the elevators are going to stop at every floor, so you don't have to touch the button. You can only have one person in the elevator at a time. They're not allowing their employees to travel domestically or international. So there are lots of very creative ways that companies are going through this process, because more than anything, if their employees don't feel safe, they're not going to be productive and they're not going to come back into the workplace. The visual I put on this is, you know, if I put a hazmat suit on and called Corey Joe back into the office, how safe is she going to feel if I'm standing here in a hazmat suit saying, hey, it's safe, come back to work?
Actually, I have a question here I want to propose to you guys. Somebody submitted it earlier. What metrics would warrant a potential second wave of closures, either this year or next year? And is that something MMAC and the business community have talked about or thought about?
Yeah, it's something we're very concerned about as the flu season picks up in the fall. And as people come back to work and come in contact, even with good social distancing, we're likely to see a rise of, you know, COVID cases and positive tests. And so the question is, do we have enough capacity in our testing to make sure that we're testing more people, that if a company gets exposed, they can test their workers quickly. And then we want to make sure that we have the ability to track and trace. And Judge Mosley gave you a great example of that, because that's what's going to take to, again, flatten the curve when it rises. And I feel confident that we've learned a lot through the past 6 weeks, that our healthcare systems are in good shape to handle an influx. And we're going to, again, have to live with COVID. It's going to be with us. So what we want to do is make sure that that curve stays flat enough so it doesn't overwhelm any of the healthcare facilities that people would need to access. And then we just need to be really smart about this. And there are certainly exceptions, but something like 70 or 80% of the people that have gotten COVID are either over the age of 70 or have an underlying health condition. And so we need to be really sensitive about how we're impacting that population. And then again, as Judge Mosley has pointed out, it is a silent disease. You can carry it for, you know, a week to 10 days, I think, without even knowing you have it. And so that's the challenge with it. It's very stealthy.
Judge Mosley, I actually have a question for you. It's an interesting.
I also want, can I piggyback real quick?
Please. Yeah.
Tim? And Tim would agree with this, I'm sure, is we'll also have more guidance actually once we get this ruling, because that's what the whole issue is can the department actually do this in the future?
Yeah.
Good point.
Somebody actually is asking a question about what level of enforcement we should expect for disobedience to stay-at-home order. So if people are having parties or gathering or otherwise not obeying the order.
Sure. So Milwaukee, the city of Milwaukee passed an ordinance with a $500 forfeiture on that ordinance for anybody who was found to have violated the order of staying safe at home. Last I saw, Chief Morales has stated that they had like 120 contacts with people who actually had been in violation of that order. Now, whether citations were written, I don't know, but there were contacts. And also what people don't understand is the police are also issuing those same citations to individuals who are out committing crimes. So if you are out committing a crime, that's in violation of the order as well. So it's going to be very interesting, because then that also goes to the problem that we're having at the House of Corrections with COVID and what to do with people who have COVID at the House of Corrections as well. So it's not only a healthcare issue for hospitals, it's a healthcare issue for our prisons and jails as well.
I think most of the municipal leaders that I've talked to don't want to be in the business of fining people. And so they're going to approach this first from an informational standpoint. So if a business is doing, let's say the governor's current order is you can't have more than 5 people in a small retail establishment at a time. All right, if there's 6 or 7 in there, they aren't going to come in and ticket somebody likely. They're going to come in and explain what the ruling is, why you should only have 5. And so hopefully this is informational unless somebody's really abusing it.
Eric, you have a question in the chat?
Yeah.
Well, before the chat, I also, from a judge standpoint, my concern is equal protection. I don't think it's appropriate that someone in Milwaukee would get a citation.
We got him freezing again. Eric, go on to the question and I'll have him jump back in when he comes back on.
Page one of the Badger bounce back plan states K-12 classes resume in person. Is that likely a scenario for the rest of the year for 2019 and 2020 school year and for summer school? And what is the risk of exposure in schools?
Well, I think there have been 0 cases of COVID for anybody under 20 in Wisconsin. And so I don't expect K-12 schools to be back in through the end of this year. It sounds more and more like some of the universities are going to open their campuses up in the fall, whether that's completely or partially. So we see that coming. But I think one of the biggest challenges we have in the city is the inequity and disparity that's occurred in terms of how distance learning has rolled out and who's been prepared to do it and who hasn't done it. And I think that a large number of the students in the Milwaukee public school systems have had a real challenge with how the district has rolled out distance learning or not rolled it out. And so I think we all need to be really sensitive to the inequities that are going to carry with us, I think, for a number of years from the lost learning over the school year and potentially what happens into the summer. And so that's something, again, we need a citywide strategy on to make sure all kids have the access to the online learning that they're going to be that they're going to need and needs to be delivered to them.
That's actually a good segue into the next question that someone asked. We've seen some stark racial and ethnic disparities in those testing positive or being hospitalized and dying from COVID-19. What things is Milwaukee doing to mitigate those disparities? And either of you can kind of jump in on that.
Well, I know that the city has set up 2 testing sites, at least on their own, one on the north side, one on the south side. I think there are a total of 17, and they're offering free tests. And so that is a good step to get out in the community and do that. And again, there have been disparities in terms of hotspots on the north and south side that have to do, again, with the challenge of the living conditions that folks are in. And then I'm sure Judge Mosley can add to that.
Yeah, so I know that the local hospitals are also doing an outreach program to get the word out. The problem with this virus is that it affects people who are vulnerable to certain diseases that don't really show every day. So high blood pressure. It's not really common that you know you have high blood pressure. And if you don't go to the doctor regularly, you may not know you have it. Diabetes. Diabetes is another one that it doesn't really show until it's almost too late when it comes to any types of symptoms that you may have. And so the concern of the medical community, at least the ones that I've been dealing with during my journey on this and being a kidney transplant recipient, is that getting the word out and having people do blood pressure tests and diabetes tests so that they can provide the services they can, whether it be medication or diet or exercise, so that they don't become people who are most likely to catch this virus.
Eric, I'm curious, what is there any special outreach from Advocate Aurora to the populations that have been especially affected by this?
Yeah, and Crystal Fornell, who's on this call or on this webinar, she can definitely answer any of the questions as well. But I think that for us, from an Advocate Aurora Health lens, is that we we have reached out to those communities with listening and focus sessions where we have gained feedback from them and really asked them how we can support them, and also creating resources that really fit their needs and how they interact with those resources as well, whether that is in Spanish for the Hispanic, Latino, Latinx communities, or if it's also in the near West Side. We recently did a chalk promotion of creating awareness of COVID-19 and safer at home, and really trying to meet the community where they're at in terms of how can we provide the best resources, and also what can we do to support you during this time. As Tim and Judge Mosley and Corey, you will attest, is that we're in this together. And so everyone has been affected by it in one way or the other. And how can we help people live well through the messaging, but also the community support. So.
Thanks, Eric. Judge Mosley, you kind of got cut off as you were answering the question around large gatherings and whether or not people will be penalized. There's another question that I'll ask you that you maybe will be able to finish that thought.
Sure.
Amy wants to know. Amy wants to know she should be calling the police on her neighbors and people when she witnesses them having large parties and gatherings. I've seen that too and wondered how people are doing that when they're neighbors.
Well, I can tell you that people are calling the police on the large gatherings, and it's my understanding that the police aren't actually issuing citations. They're breaking up those parties. And I think that is the way, I think Tim mentioned that is the way to handle it at this point. My concern was equal protection. My concern was I didn't want people in Milwaukee to get citations, but then you cross the border into Brookfield and you could have your parties, your graduation parties, and what have you. So that was my concern. I wanted to make sure that if we are going to enforce this law, it's going to be enforced equitably and equally to all communities in the state.
Thank you for that response, Eric. I think we have time for one more question from the chat and the Q&A.
Yeah.
It's hard because there's more than one question, but.
How will repealing the Safer at Home order affect businesses that are not able to open at full capacity? And then the second part of that is, could businesses lose their ability to apply for state relief funding to lay off employees or close their businesses due to lack of sufficient income and customers?
Well, so the first question is a very practical one. And if you look at some of the gating criteria where restaurants can open, but only at 25% capacity or 50% or 75%, as most business owners will tell you, nobody's going to charge you 75 or 50% of rent. And most of these businesses cannot function profitably at 25 or 50% of capacity. So it's going to be a real challenge, because until they have the ability to run their businesses and attract customers back, that's not going to happen. I've seen some creative ideas about opening up the streets and allowing people to dine out on the street. That may be fine, but it's still snowing in May. So we do have weather challenges with that. So again, I think this is going to be a really slow go for some restaurants and retail establishments that aren't going to be able to function until they get a broader response from consumers and the ability to handle them. And then you get into a very technical question on, if I've got funding and I've got my employees and I'm paying them through that funding. And so another thing I think we're going to see happen is at the end of July, the federal stimulus checks, the $600 combined with the state checks, those are going to start to roll off. And in some cases, you're going to see people who were furloughed and carried along like that. They are going to not return to their companies. They're going to lose their jobs because of the downturn in the economy. And that's going to be another wave we're going to have to deal with.
Okay, as we're nearing time, we're getting a lot of love for both of you. People are really appreciative of the discussion. Judge Mosley, you're a ray of light. People are so happy that you came through the infection well. And
appreciate that.
I mean, you are just a wealth of information, and we're getting a lot of comments from people with their appreciation, and we'll share those with you afterwards. So as we close, I always like to ask folks, what in this whole process, as strange and weird and terrible as it has been, it's also been an opportunity to stretch and grow and innovate. And are there any one thing that you would carry into the new normal that you've learned either about yourself or about doing business or the world, how we socialize going forward? Tim, what would you keep?
Well, what I would keep is I crave the personal interaction. And I think we've lasted so far based on the deposits we've made with each other that we can draw on virtually. But I'm hopeful we don't have to do this through screens. And, you know, I'd like to see everybody on this screen personally and not through a screen.
Mm-hmm.
Mine is actually, I am so encouraged by the innovation that I have seen. And what I mean is I never thought in a million years that Sanford's would do carryout. I never thought that. And so now, I mean, the innovation that restaurants are doing, whether it's at Egg and Flour, they're putting up the plexiglass in between tables, and whether it's the way they handle their curbside delivery or pickup. I just think I love the way that the businesses in the city have innovated and have tried to make the best out of this situation. I hope that carries on.
How about you, Eric?
I think that as Tim and Judge Mosley eloquently stated, I think that for me, especially in a healthcare lens and then also a community lens, is that during this time, it has been beautiful to see our communities coming together for the most part. Supporting one another, loving one another, going above and beyond to deepen the relationships that we may have had or reestablish relationships or create new ones. I think that there's new sense of opportunity and we're persevering, we're taking it one day at a time. And I think that this is a beautiful example of what is our community and really what our community can be going forward in terms of unconditional support, respecting one another, whether we agree or not agree on political and religious issue or anything else, but like having a sense of new respect and love and admiration and local support is a beautiful thing. And that's what's going to prevail our community to move forward and reframe that narrative.
I absolutely agree. Even through the screen, we've been able to continue having a sense of community and connection, and we've had to call and reach out to a lot of people to make these conversations happen. And I really appreciate everyone that has attended these webinars and all of the panelists up until this point, especially Tim and Judge Mosley. Thank you so much for being here with us today. I really appreciate you.
You're welcome.
Thank you.
Thank you too, Eric. You're always a great co-moderator.
Thanks, guys.
Yeah, as we close out, I'm just gonna do a little promo on our upcoming webinar. So, you know, Tuesdays and Thursdays are webinar days for FUEL from 2 to 3. We have a series of 3 Smart Money Moves webinars that are very specific to all of the money concerns that folks are having right now, managing your money in a crisis without losing it, your money and your mind. So make sure you go to the website and check that out. Thanks again to the panelists, and thanks for all of you being here with us today. Have a good rest of your day.